So hi, I'm David Macdonald. I'm a hematologist from Halifax, Nova Scotia. Particular interest in lymphoma. My practice is primarily malignant hematology with a focus on lymphoma. We're here at the CHC in Toronto, and it's been a pleasure to be here this weekend. I chaired a session on non-Hodgkin lymphoma. 3 sessions in this session, and I found that it was a very useful time because all 3 sessions really focused on questions that are becoming clinically important in our practice. First, Dr. Pitaluga talked about the molecular characterizations of diffuse large B-cell lymphomas, and this has been sort of going on for the last decade, first with cell of origin discussions, and now with the importance of MYC translocations and the so-called double hit and double expressor lymphomas. And she really did a very nice job of putting that concisely into a way that clinicians can understand it and understand how it impacts on prognosis of patients. Particularly interested in the fact that she demonstrated that the partner that the MYC is translocated with is probably more important than whether the MYC is translocated or not. In other words, if it's translocated with an immunoglobulin partner, then that predicts a poor prognosis, but those MYC translocations with non-immunoglobulin partners do just as well as those that are not translocated. I then spoke about the management of relapsed refractory indolent non-Hodgkin lymphoma, which I think is also a very interesting time for the way we treat lymphoma because of so many new agents that are becoming available on the market. In addition to the fact that we've changed our paradigms in treating indolent lymphoma, where before we minimized toxicity of therapy up front, and so we would use single agent chlorambucil followed by fludarabine, and then get into more chemotherapy combinations. But with the results of the STIL-1 trial showing superiority of BR over R-CHOP in frontline and a long duration of first remissions, we really have moved more potent therapies up front, and it makes it a little bit more difficult to choose second and third line therapies and so on. So looking at novel agents like lenalidomide and delalisib and ibrutinib really gives us some hope that there's going to be more options to come for these patients. Finally, Dr. Richard Sang talked about the role of radiotherapy in diffuse large B-cell lymphoma, which again is something that we have been debating in the clinic and in the pathology and lymphoma tumor boards for the past decade. He did a very nice job summarizing where we are and what the treatment strategies are here at Princess Margaret. And then he talked about the role of PET-CT scan, which we now all have access to in the last few years, which really is confusing the situation because a patient who previously might have been in a partial remission based on a CT scan, now with residual activity on the PET scan, there's always the question of what to do. So I think he did a very nice job of summarizing recent data to help guide us going forward. So all in all, I think it was a very good session on non-Hodgkin lymphoma, and it's been a very good meeting. Thank you. For more information on these topics, you can find conference reports at careeducation.ca.